Of all the body parts, the hip complex seems most systemically involved with every patient I've treated in over 19 years of clinical practice. The hip complex includes much more than the hip joint. It includes the sacroiliac joint, lumbar spine, the pubic symphysis, and of course the hip joint, which joins the pelvis and the femur. Of all the joints in the body, the hip complex is the most important because it is directly controlled by our core musculature as well as the extensors of the spine, the gluteal muscles, hamstrings, your TFLs, piriformis, the pelvic floor, and also your hip flexor, iliopsoas. It's an area of the body that most often gets skewed, traumatized, weakened, and dysfunctional. And according to the somato-emotional release technique by the Upledger Institute, the hip holds all our emotional trauma since infancy. The hip complex also dictates the dynamic motor patterns of our body because the nerves that control the lower extremities extend out from the lumbar spine and forms a plexus, which is a complicated weave of nerves transmitting signals for our various leg muscles. Not only that, it can affect the health of our female and male body parts, our detox organs like kidneys, our urethra, ureter, etc. And when our hip complex is dysfunctional, it can affect your body up and down the kinetic chain. For example, your neck, your shoulder, your elbow pain can stem from the hip complex. In the same way, knees and ankle pain can also stem from the hip complex. And when treating patients, it's the first area of the body that I assess to make sure all bones align and dynamic movements are symmetrical. And in most of my patients, the hips are malaligned and lack muscle balance. This is because often our motor habits are off balance due to routinely crossing our legs, standing, leaning to one side, and for us women, our hormones can also affect the functions of our hip. Why? Because when we're lopsided at the pelvic structure due to the imbalance created by our habitual motor patterns, it changes the structural alignment of both the hip to pelvis and sacrum to pelvic bone. And if you are a woman who has had children, childbirth can traumatize this region by creating a separation of the abdominal muscle, also known as diastasis recti, pelvic floor weakness, widening of our pelvic bone, and tension through the sacroiliac joint and collective instability due to all of the above. Muscles are designed to respond to such structural strains by overreacting, underreacting, or completely shutting down. So as you can see, our hip complex is so much more than just a joint. It can directly impact all parts of your body and health. So if you're one who struggles with low back pain, hip pain, knee pain, or any musculoskeletal pain, make sure to get your lumbopelvic hip complex checked to ensure all is aligned both statically and dynamically. So what can you do to prevent or heal from such imbalances? Well, first, be mindful of your movement and refrain from straining. Most of us are not aware of our body in space. So at first, it'll be hard to slow down and listen to your body. But feel your body, connect with your body, then correct and retrain our bodies. And over time, you'll notice a shift in your body and begin to feel the shifts and changes and be able to self-correct. I always have to remind my patients that less is more. Slowing down to feel, isolating the muscles, and activating specific muscles, and get clear about the outcome so that everything that you do supports your overall goal. I've been seeing many of you who are fitness and wellness fanatics who feel your bodies falling apart despite all the years of doing the thing that you thought were helping you. But when exercise becomes strain, inflammation ensues and our body will react to the negative input by becoming acidic. So I encourage you, as you continue on your health journey, be mindful of your practice. Slow down to connect with your body and practice being present in the moment, and I promise your body will begin to respond and listen. I love this quote by Marianne Williamson. Joy is what happens to us when we allow ourselves to recognize how good things really are. On that note, we will also be adding more classes such as Hot Hip Opener, a yin-based class that focuses on the lumbopelvic hip complex to improve stability, flexibility, and balance. We also will be adding Hot Pilates and Yogi Lattes or Yoga Lattes classes, where we will incorporate yoga, barre, Pilates-based exercises. But please fill out the survey below on the link and give us feedback on your preferences. And if you love yoga and want to dive deeper, please join us for our 2019 Alkaline Yoga Teacher Training. This will be an opportunity for you to deepen your personal practice, understand your body, learn anatomy, physiology, and spirituality of yoga, but also how to apply the concepts in your own life to help others do the same. It's a 6-month program where we dive deep with the ultimate goal of transformation to a better and healthier you. Please fill out the survey, and we will look forward to hearing back from you. And the Yoga Teacher Training application link is also below. And if you enjoyed this message, please like us on Facebook, Alkaline Wellness, and Lupus Rebel. And also follow us on Instagram at Alkaline Wellness and at Lupus Rebel, and subscribe to our YouTube channel at Dr. Connie Jian. Thank you so much, and I'll see you guys next time.